Where did the interest in health policy emerge from?
I had no concept of health policy. I actually chose the PhD track in part because I liked science. I was working in a lab. I understood the idea of pursuing a career in science. But again, finances and the decision about finances drove everything. MD PhD programs, some of them offered full tuition. I could not comprehend the idea of going to medical school, taking on this huge loan, and it just was not something that I would have been able to do. And so I applied to MD PhD programs, again, out of necessity. Also, though, I actually did like science. So it wasn't just it wasn't just because of finances. But in the process of being in medical school, I recognized that that was not my passion, that lab research was not my passion. And instead, when I saw that what was making my patients sick wasn't just about the medical care that they had access to. It was also about something else. And it was that something else that the public health policy, I didn't have any concept of that until I started medical school and until I started seeing patients. But once I realized that, another thing that one of my mentors, Senator Barbara Mikulski, says is you should do what you're best at and what you're needed for. And I like science. I was good at working in the lab, but I thought that what I was the most passionate about, and also what I could do best, was to be an advocate for my patients, to work in this policy and advocacy and public health space.